Today marks 2 years since the World Health Organization declared the coronavirus a pandemic. Right now, COVID cases are declining and mask mandates are being lifted. Dr. Mallika Marshall has more on what we've learned and what might be ahead.
2 years ago, the world was facing down a new virus with many unknowns, especially that it was capable of spreading so easily.
We already knew enough about it to know that it was going to be serious. And it proved to be serious.
Nearly 80 million have since been infected, and more than 950,000 have died, as the United States and the rest of the world experience surge after surge from variants like Alpha, Delta, and Omicron.
Don't know enough.
Dr. Bill Hanage is an epidemiologist with the Harvard T.H. Chan School of Public Health.
Everybody wants to know whether there is another variant coming. And I'll tell you what, I don't know. But I will tell you that I never bet against natural selection. We shouldn't be assuming that the virus is done with us.
What preparation should we be doing?
We should be maintaining our ability to test. We should be enhancing our ability to produce new vaccines if and when they are needed. We should be redoubling our efforts to get shots into the arms of those who need them most.
The other big question, when will we reach the endemic phase? Which doesn't mean the virus disappears, but rather that we're not seeing large case spikes.
I don't think we're in that state just yet, although hopefully we're going to be in a state where we've got a kind of amount of disease that we can afford to not be obsessing about it all the time.
Dr. Hanage says while we're in a far better place than 2 years ago, we need to learn from this experience that pandemics don't simply go away.
If we sweep them under the rug, they come back stronger, they come back harder, they kill more people.
A lesson that could save lives later. Dr. Mallika Marshall, CBS News, Boston.